It's the appointed time. We have a quorum. I call to order the meeting of the subcommittee. Today, we are to discuss the item post-retirement medical benefits for civil service eligible persons, CSEPs. It is a very important topic, especially for those appointed on the new terms. The subcommittee has held 6 meetings so far. The next meeting, I would suggest that it should be held on 19th of March, Tuesday, at 4:30 p.m. We are to discuss item G in the list of major subjects to be studied, that is, civil service housing benefits. Do members wish to make any comments? If not, we'll move on. The item to be discussed at the next meeting will be the last item on the list of major subjects to be studied. If members wish to suggest other items that are to be discussed, please let me know or notify the Secretariat after the meeting. Do members have any questions? If not, we'll move on to agenda item number 1. Post-retirement medical benefits for civil service eligible persons. I remind members that in accordance with Rule 83A of the Rules of Procedure, if members have any direct or indirect pecuniary interest relating to the item under discussion, they should disclose so before they speak on the item. Let me first declare an interest. I am a retired civil servant, Mr. Dennis Leung. I would also like to declare an interest. I have family members who are retired civil servants and in-service civil servants. Thank you. Let's invite Mrs. Ingrid Yeung, Secretary for the Civil Service, and her team to come inside the conference room. Members, if you wish to ask questions, please press the Request to Speak button. I will assign a 5-minute time limit for the first round, questions and answers included. Welcome, Secretary, Mrs. Ingrid Yeung, Secretary for the Civil Service. I would also like to welcome Mr. Clement Leung, Permanent Secretary for the Civil Service, and Ms. Ann Chen, Deputy Secretary for the Civil Service, to the meeting. I'll now ask the Secretary to brief members on the paper provided by the administration. Thank you, Chair. The paper briefs members on the provision of post-retirement medical benefits for CSEPs. The government, as the employer, has an obligation to provide medical benefits for civil servants according to the conditions of service. But for different categories of civil servants, they will be entitled to different kinds of medical benefits. For those appointed before 1st of June 2000, that is, we would say that these are officers appointed on pensionable terms. They and their eligible dependents will continue to be eligible for civil service medical and dental benefits after the officers have retired. The only difference that they would have before retirement and after retirement would be that they are not entitled to the civil servant discs arrangement at general outpatient clinics of the hospital authority. That is because the consideration of returning to work as early as possible after receiving treatment is not applicable to them. For civil servants appointed on the new terms, that is, officers who were or are offered appointment on or after 1st of June 2000, they and their eligible dependents are entitled to medical and dental benefits when they are in service. Such benefits will cease when the civil servants leave service. The relevant conditions are set out in the Memorandum on Conditions of Service for Officers appointed on the new terms. The current civil service appointment system was introduced in response to the civil service reform in 1999 after extensive discussion and consultation on the provision of fringe benefits. The basic principle adopted by the government is that the benefits should be provided with broad reference to the practices and arrangements in the private sector. They should also be sufficient to attract, retain, and motivate staff of suitable caliber to provide the public with quality service. As those appointed on the new terms will not be entitled to post-retirement medical and dental benefits, there are views proposing the government to consider allowing civil servants appointed on new terms to make early withdrawal of the accrued benefits attributable to government's voluntary contribution GVC benefits under the Civil Service Provident Fund CSPF scheme when they are in service for the purpose of taking out medical insurance. The CSPF scheme aims to provide retirement benefits for civil servants appointed on the new terms. This would constitute a funded approach to provide retirement benefits. We thus think it should not be regarded as benefits that are ready for withdrawal at any time. If we allow civil servants to make early withdrawal of their accrued benefits, it will defeat the original purpose of establishing the CSPF system to safeguard the livelihood of civil servants after their retirement, but also have a direct impact on the retirement protection of colleagues. The government has great reservation about this. In fact, with reference to the medical insurance plans currently available in the market, including the VMIS, that is the Voluntary Medical Insurance Scheme for Civil Servants, as well as the Voluntary Health Insurance Scheme VHIS approved by the Health Bureau, the annual premium for basic medical insurance with hospitalization coverage for the age group of 25 to 50 is about 2,000 to 4,000 per annum. For the age group of 50 to 65, it is about 4,000 to 8,000 per annum. The premiums are believed to be affordable to the vast majority of civil servants. All in all, we adopt the approach to set the pay and benefits for officers appointed on the new terms to be on par with those provided in the private sector. And in fact, in the private sector, such fringe benefits would only be provided to in-service employees. Thus, the government has no intention to change the existing policy. The government, however, would continuously review the relevant measures and propose enhancements if necessary. An example would be the fact that we will introduce marriage leave and compassionate leave for government employees from 1st of April this year to meet their family needs arising from marriage or bereavement. That's it for my report, Chair. We welcome members' questions. First, Mr. Dennis Leung. Thank you. Chair, I want to ask about the issue of CSPF scheme. The Secretary said that the government would provide voluntary contributions on top of the mandatory contributions of 5% for officers appointed on the new terms. For those who have been in service for 3 years to 15 years, the government would make a 15% contribution. That is a 10% additional contribution on top of the 5% mandatory contribution. That is indeed a significant amount. For those who have been in service for over 30 years, the government would make a contribution of 25%. So indeed, that is quite a significant contribution. For teachers working in subsidized schools, for those who have been in service for 10 years or above, the government would provide a 10% additional contribution, and for those who have been in service for longer, they would get even more. But the problem is the investment is made in MPFs, and the products offered are just the existing carriers of MPF schemes. They may opt for different options such as China Growth Fund or funds investing in other regions, but the fact remains that the investment returns are not as high as non-MPF products. And these funds are not necessarily managed by fund managers. If there are fluctuations in the markets, the fund managers may respond a little quicker. For example, when the market situation is less than ideal to minimize losses. Also, when the prices are attractive, the fund managers would purchase more in order to take advantage of the lower prices. MPFs would not be as favorable in this regard. It was suggested earlier that officers appointed on the new terms should have more say in the investment. And in fact, according to the annual reports of MPF products, they would provide managers' fees of less than 0.1%. So I guess they don't make much in such investment products either. So for teachers, they will be able to focus on their work, and that would be beneficial because if they have fund managers managing their funds, they wouldn't be worried about that. In future, will the administration consider that in the light of the fact that we are not having high returns for the MPF products will not provide adequate retirement protection for civil servants. So will you consider providing more options to civil servants? In turn, that will attract and retain more talents in the civil service. Thank you. Secretary, thank you. The CSPF scheme is a scheme under the framework of the MPF scheme. So the government would make voluntary contributions on top of the mandatory contribution, but the operations would have to dovetail or would have to be restricted under the framework of the MPF scheme. If we make any changes, as the government is the biggest employer in Hong Kong, it may have a great impact on the provision of such contributions by other private companies. There are tens of thousands of teachers in Hong Kong, from what I remember, and civil servants would amount to a much larger figure than that. So we have to be careful in this regard.
Another point is that the teacher scheme, I understand that they don't frequently rely on this protection but the government safeguards a 5% return. So our colleagues in the Treasury have also participated in this. And if we don't have that in place, will it be the same as the teacher scheme? Well, all these issues are very complex, and I will not respond lightly saying that we will consider an alternative to operate the Civil Service Provident Fund investment side of things. The Provident Fund is applicable to all employees in Hong Kong. So if the government takes the initiative to deviate from the framework, it seems that it would have an impact on confidence in the MPF scheme. I'd like to clarify one point. Whether it's subsidized schools or other schools, the government has to underwrite a certain return. Is that the case? And if they comply with Chapter 297C and so on, does it spell out that there is a 5% return on investment? But if there is market volatility and if they have insufficient funds to pay out dividend, well then, according to the law, they can take a loan from the government to pay dividend. But it does not involve a government underwriting, because if they take out a loan, they have to pay it back. And according to the law, in the next year, if their investment return, if they cannot return the loan, if they cannot pay off the debts, they can issue extra dividend. And in the subsequent year, if the returns are not ideal and they cannot pay off all the government debts, then according to the formula, aside from the guaranteed 5% return, they might pay extra dividend. They cannot pay extra dividend in that case. So I hope the government can re-examine this situation, and the subsidized school teachers, their Provident Fund investments, they have to be accountable for themselves, and they might be able to second colleagues from the Treasury Department, or when they recruit an investment fund manager, every 2 years they might recruit an external consultant to look at their strategies. It does not involve extra government funding. It is all undertaken by the fund itself. Now, I have conveyed this information to the relevant unions, and if the government takes the initiative to deviate, will that lead to the collapse of the framework? Well, that is a different issue. The law does allow for also the occupational safety and so on. So if NGOs and companies such as Cathay, they have their own occupational benefits, including ORSO, and they have returns of between 4 and 6%. So most importantly, the idea is that we're not insisting on MPF. MPF is just a framework, whether it's employees or employers, they have to join this retirement fund scheme. But if the investment methodology, if the returns are not ideal, they can still subscribe to other schemes and seek exemption from MPF. So the teachers fund, they had also sought exemption from MPF, and over the years we see the operation has been smooth. And when MPF was established, we still had other retirement schemes in operation. So even new companies, they don't subscribe to MPF as long as they have their own retirement schemes, and the government allows for that. So Mrs. Ingrid Young concern about deviating from the framework will lead to volatility. Well, you also need to bear in mind we have some 2-3 million workers in Hong Kong, and teachers only make up for 40,000 or so, and civil servants on the new terms of service, it's about 120,000, so it's about 3 times this life. So if the scheme is successful, then it can be a bright spot, and it can also uh, energize the investment industry. So management fees are applied even if you subscribe to the fund or not, and it's not conducive to the growth of the industry. I'd like to add my comments, and Secretary can respond. We understand that the MPF concern, our retirement scheme is made up of 3 pillars. We have employee contribution, employer contribution, and after so many years, I believe all Hong Kong has a consensus that the MPF, the trustees, the fees they charge is not in proportion. At the extreme, it's 3 or 4%. So every year, the employees' contribution to MPF and the employers' contribution, a lot of the return is paid off in administration fees. So by and in today's market, we have different investment vehicles. There are bonds. For example, we have the airport authority bonds that are very promising. So they don't charge a penny in management fees. So the government has provided a platform to bring down the management fees, but till today we haven't seen any impact. So for civil servants on new terms, their contribution and the government and the employer's contribution, can there be fine tuning and improvement? I believe at the very least there should be a starting point where we think about it. You could discuss it with the MPF. We want to decrease the administrative expenses. We want a higher return. You also have to bear in mind a sum of money you contribute now in 20, 30 times, it can be compounded. And the interest that you collect every month, if a substantial part of it is deducted by management fees, then your savings effect is largely diminished. Now, my understanding, the Secretary can confirm that later on. Right now, for each civil servant on new terms, they can pick from the market. They can pick a fund manager to invest. So it's similar to us purchasing a Mark 6 lottery ticket. Past track records are not reliable. So the framework could be further reviewed. I'm not saying that you should modify it. I fully accept what the Secretary said. If there's any change, there will be a profound impact. But at the very least, you can look into it. Listen to people's views and opinions. All civil servants on the new terms of service, when they retire, that is the money they will rely on for retirement and medical expenditure. So you have to bear in mind, if they spend all their money, they have to seek other forms of financing, and the government will have to think about the implications. So we have to think about how we can use our reserves right now and allow the returns to compound. Now, recently in the FC, we had talked about an injection of $1 billion into the One Belt One Road initiative, and members' concern was the Education Bureau had commissioned some consultants to manage the money, and every year they charge some 5 million plus, and they only can generate a 4% return. So why can't I buy the safest bonds? If you place it in the bank, you can get a 4.5% return, and you can save on management fees. So the general working population are paying more and more attention to this. So in the current environment, well, we want the civil servants on the new terms of service. We want them to have extra safeguard in their retirement years. So we do need to have a discussion with the relevant stakeholders. Why we have to look at why subsidized school teachers, why are they so successful? There must be something we can learn from them. Can we take the current regime and fine tune it so that there are better returns? So I think from at any point in time, from any perspective, that should be something you can look into. That's all I want to say for the time being. Secretary, we understand that the general working population, including civil servants, they do have some views on the operation of the MPF. I'm not speaking on behalf of financial services and treasury, but I understand that the MPF authority, they do wish to fine-tune the scheme, and as chairman said, the platform that was introduced could reduce the management fees. And I'm aware that their timetable should be by next year. The platform should be able to do something about it. So we have statutory bodies, we have the MPFA. So the government had set these bodies up to help monitor the scheme. So we will inspect the scheme, its operation, to see how we can improve it. So if you look at the Teachers Fund or other specific companies, my understanding is before the MPF, there were already these retirement schemes in place and they were able to receive exemption. But after the MPF was implemented, new schemes and even the civil servant schemes, they should be operating under the MPF platform. So we are also continuously fine-tuning the MPF scheme. Our service providers, the fund managers under MPF, we have tender exercises on a regular basis. So we will have new service providers, and we can provide a choice for MPF subscribers. So subscribers to the MPF, they can look at the track records of these fund managers, and it's not blind luck. So I've heard your views, and we will continue being the largest employer in Hong Kong, we do want to take care of their retirement benefits, and we will reflect those views and hope that MPF authority can deal with it appropriately.
下位
All right, next, Mr. Kwok Wai Keung. Thank you, Chair. Secretary, please excuse my repeating of what I said before. For officers appointed on the new terms, they will have nothing after retirement, so it's the same issue again. The budget figure provided by the hospital authority did not take into consideration of the needs to be provided to officers appointed on the new terms. If the hospital authority is not to provide services to officers appointed on the new terms, will you take back the provisions provided to the hospital authority to provide services to civil service eligible persons, CSEPs? Another issue is about MPF contributions. The Secretary said that the operations of the CSPF scheme would have to align with the operations of the MPF scheme. But I'm sure you've heard the South Side say this multiple times. While we do understand the mechanism of the CSPF scheme, the staff side is concerned that their benefits may not be maximized, while it should be maximized because we have so many civil servants buying MPF products in bulk, and they are also concerned about much of their returns being deducted as management fees. The Secretary said that the civil servants should select products after careful consideration, but perhaps due to lack of knowledge or simply due to lack of time, civil servants may not be able to select the best products that are suited to their needs. So I think we should have something like the Grant or Subsidized Schools Provident Fund that will select the right products for teachers and provide them with relatively generous returns. So we think that the administration should really do more and aim to maximize benefits for civil servants. You shouldn't only say that you have to be restricted to the MPF framework. Can you consider the interests of civil servants and do more to provide civil servants with adequate or more retirement protection? Thank you. Secretary. Thank you. I understand that the provisions for the hospital authority would be reviewed every year when the budget is being formulated. Civil servants are Hong Kong citizens still. If they are not receiving services of the hospital authority as civil servants, they will still get services as Hong Kong citizens from the hospital authority. So the hospital authority would still need provisions to provide services to the citizens of Hong Kong. And I understand the provisions were made and with this consideration in mind, and I believe it will be so in future. So it is not appropriate to say that we should carve out the provisions that were provided for civil servants on pensionable terms from the provisions provided to the hospital authority. At least that is my understanding. I'm not the authority here. As for whether officers can be allowed to participate in the management of the Provident Fund, how it works right now is that the employer would select the carriers of the scheme, and the carriers would provide various products for the choosing of employees. And right now, under the CSPF scheme, we have allowed for multiple options under a single carrier. And for the investment portfolio or the investment preferences of the products, colleagues would have to choose the ones suitable for them based on their own preferences. It cannot be interfered by the government. When we invite tenders for the CSPF scheme, we would consider different factors, including the cost effectiveness of the products offered. The government regarding the performance of the carriers of the scheme has reviewed if there is any room for improvement. The staff side did raise some concerns, and we have followed up with them on such concerns. Well, anything else? If not, it will be my turn to speak. According to paragraph 4 of the paper, the basic principle of the government is that the benefits provided should be sufficient to attract, retain, and motivate staff of suitable caliber to provide the public with quality service in terms of effectiveness and efficiency. After that, it is said that the private sector does not provide post-retirement medical benefits for their staff currently and either before or after 1999. That's why the administration considered it appropriate to not provide post-retirement medical benefits, because this is what the arrangements are in the private sector. But this, let me point out, is in conflict with the basic principle adopted by the government. The government would provide post-retirement medical benefits to officers appointed on pensionable terms, but not those on the new terms. So will the government still be able to attract, retain, and motivate talents? You have basically tied up your own hands because you have lost one aspect that could make it very attractive for talents. There are many officers appointed on the new terms who have left because they think that if they have better prospects after 10 years of service, they would not hesitate to resign. For officers appointed on pensionable terms, they would hesitate because they would still get pension if they retire without leaving civil service. So you have lost essentially an effective tool for you to retain talents. So I would ask the administration to provide us with some figures. For example, in the past 5 years, for staff who have left the service, how many of such officers are appointed on pensionable terms and how many of them on new terms? If we have such figures, we would be able to tell whether the staff side representatives have told us what is indeed happening at the moment. Also, if we are providing officers appointed on pensionable terms with adequate protection and that is desirable, why are we not doing the same for those appointed on the new terms? Is it due to financial considerations? If it is the case, my view would be that no matter whether the officers are appointed on the pensionable terms or new terms, they would still want post-retirement medical protection. And for those who want post-retirement medical protection, it's not just about the protection itself. They are not opting or they do not want private insurance because the premiums that they would have to pay when they're older would be much higher. Of course, when it is a critical illness, it may be covered by other products, but if the illnesses are minor in nature, they would definitely want some basic medical insurance with coverage in that regard. The civil servants would have to go back to the public healthcare system right away if they cannot afford private insurance. And the administration would not be able to make projections if they do not provide such post-retirement medical protection at the moment or do not take into account such needs. So if we can provide adequate post-retirement medical protection to officers appointed on the new terms, not only will they rest assured that they will have good medical protection upon retirement, they will also be motivated to work in the civil service until they retire. So I think it is not so simple as to that you are saving costs at the moment and that would be it. You do want to think about what is happening in the long term. In paragraph, it is said that the government's stance is that it has no intention to change the policy concerned, and that any change would bring significant impact on public financial resources. I do understand you have no intention to change the policy concerned at the moment. Even if you intend to change the policy concerned, it may take much time for you to study the options for changes to be implemented. Since we already know that there are shortcomings to existing arrangements, should you start early and explore other means to meet such shortcomings?
So we would like you to allow civil servants on the new terms of service to receive a lump sum. The paper says that the government does not feel that civil servants should be able to have early withdrawal from their provident fund because that defeats the original purpose. But if there is a plan with a good intention, I think that is a different discussion. It does not contravene your policy on the in fact, it does the opposite. It motivates, it retains personnel. So we can examine it from a different perspective. We can comply with your original highest goal that can still be met. On the medical insurance side, I observe, well, we like to compare with Singapore, and their provident fund has a separate component. One component for housing, the second component for medical insurance. So what's the benefit of that? So when you have a health emergency, you can use that savings for private health care. You don't have to inundate the public system. So if you consider the civil servants under the new terms of service, when they fall ill, they have two choices, either public or private health care. So when they consider their healthcare options, their first choice would be the public healthcare. It's cheap, it's efficient. What are the drawbacks? That there's a long queue. So then they will consider private sector. If they go to the private sector, that's a different set of problems. They have to come up with a large sum of money up front. So if I don't have enough money in the provident fund, that's a big problem. So that they are forced to go to the public sector. So you are adding to the public sector healthcare queue, and when they don't have enough money, they have to queue in the public sector. So their treatment is deferred. Now we understand that what's the issue with deferring healthcare for elderly. We don't have to talk about that. We understand. So Singapore is a good example. Why not? The government contribution, I think the government makes the largest contribution. You can contribute up to 25%. So why can't you allow them voluntary withdrawal? They can't withdraw in a mandatory scheme. So why can't they make withdrawals in a voluntary scheme? So that confounds me. In paragraph 8, you say that the relevant contribution should not be funds that could be withdrawn arbitrarily at any time. Well, when I read withdrawal at any time, it has the connotation of arbitrary. So if I have, if my son needs to get married or daughter needs to get married, I need extra sum of money. No, we're talking about retirement and medical benefits. you also say that you want that money for future needs, and you've given an example. Aside from living expenses, there are medical expenses. We understand the only advantage of medical insurance is if the earlier you subscribe, the lower the premiums. So for large operations, we're talking about 150, 200,000 in private hospitals. So you should allow them the ability to make decisions on how to use that funds. So in paragraph 8, you say that it contravenes the MPF scheme intention of safeguarding retirement living expenses. Well, if you look at it from my perspective and the examples I gave, it actually strengthens the safeguards because they're not allowed to withdraw medical insurance arbitrarily. It's not at will. It's after deliberate thought. There are checks and balances. There are serious considerations. So it will not affect retirement medical benefits. And according to the paper, we need retirement benefits to cover living and medical expenses. So if they don't have sufficient funds, they'll queue in the public sector, and ultimately the government has to foot the bill. So the bill comes back to the government. So your position that you have reservations, well, my view or my position is that your consideration is not thorough. It's not comprehensive. So I hope the government, after hearing from the subcommittee today, you can revisit the issue and look at it. I'm not saying you have to change your policy, but I think more consideration, a more thorough scrutiny of the pros and cons would be appropriate. Secretary? Well, Chairman, allow me to also describe our thoughts. Chairman, you're correct. Our civil servants' remuneration and principle is to retain and attract suitable staff to provide quality service for our public. But that does not mean that in the 1999 civil service reforms that we have scrapped post-retirement medical benefits. It doesn't mean we scrapped these benefits. So the whole design of the retirement scheme, according to my understanding, the voluntary contribution, the employer contribution is the highest. And the design was to attract staff to stay in the service because the longer they stay in service, the higher the benefits, the higher the contribution. So after 10 years, there's a 15% contribution. So it's equivalent to an extra 1.8 months of salary. And at 25%, it's almost a 3-month extra salary. So that is a substantial contribution. The purpose is to retain staff in the civil service. Now, Chairman, you mentioned just now that the MPF scheme and civil servants under the new terms of service, they can leave after 10 years. So this comes back to my point of a larger contribution the longer you stay in the service. So in the past we had pension and there were less people leaving the civil service. That's not necessarily the case. Uh, we do have talks with the private sector, and we see that the new generation of young people, they have different life choices. They seek different experiences. So after working a certain period, they want to seek further education, or they want a different career. So these are the considerations they have before they quit the civil service or change careers. So if you, in our past subcommittee meetings, I have reported that the overall number of people who have left the civil service, it's about 2% or 2.2% compared to other industries that where there are double-digit figures. It's still very low. And amongst the people who have quit, who have left, some have left in the probation period. They had chosen to leave early before probation ends. So after 10 years, the attraction to stay in the civil service not being large, I don't see that figure being very high, or indicating that we're not able to retain staff. Our current retirement benefits, whether there are or there aren't medical benefits. Back in 1999, we wanted to be on par with the private sector, but that doesn't mean we're copying the private sector. The government cannot be worse than the private sector in attracting staff. So whether it's remuneration or benefits, the whole combination has to be balanced. We have to consider the treasury impact as well. So I also want to respond in greater depth, allowing civil servants to withdraw from the voluntary contribution to purchase medical insurance. The adverse impact and our reservations. First of all, after retirement, some people think that medical benefits are important. Some think housing is more important. So, can people withdraw money for housing? Well, some people feel education is also important. They want to spend more money on their children. It can also help with their retirement. So all these factors have to be considered. Well, if everything is allowed, then if you allow withdrawal for all these considerations, then won't have anything left in the fund. So if you look at the whole Hong Kong MPF, the employee contribution rate is very low. So that is very different from Singapore. Singapore has different pockets, as we call them. They have housing, medical benefits, but it can go as high as 37%, 37.5%, if I remember correctly. But in Hong Kong, the employee's contribution is very low. The mandatory part is very low. Every month, employees receive a substantial part of their salary, and they can spend it on what they need, including medical insurance. So in the beginning, I quoted some statistics. We have some designs for civil servants. We have some products designed specifically for them. The employer side has also participated in the design. These are not expensive. These civil servants, they they can afford these products. So the MPF design is different. We have reserved a lot of components for staff that they can use, and they can use these for different areas in their lives and in their future retirement.
That's why we can't compare our system to that of Singapore. If we are making so high contributions in Hong Kong system, then colleagues may have different views. As for whether there should be withdrawal of the accrued benefits of GPC benefits under the CSPF scheme, it may not be arbitrary, but even if we allow for considered withdrawals, it may affect the product providers' views because the funds are often provided with long-term returns in mind, for example, in 20 or 30 years. If withdrawal is allowed, then the providers may have different views about the investment portfolio, and they may charge higher administrative fees. And this in turn will affect those who do not withdraw from the funds. In fact, it may be unfair to them, so to speak. So we have great reservations. We would say that for the withdrawal of the accrued benefits for the purpose of taking out medical insurance, on this topic we have involved the staff side. We would consider that the voluntary medical insurance scheme for civil servants VMIS to be sufficient. Some of the products under the VMIS are in fact products available under the voluntary health insurance scheme VHIS, and as you may know, products offered under the VHIS would provide great medical protection, and the increase in premiums would be relatively stable and low. The increase in premiums would only make reference to significant factors such as the age and conditions. So, as such, products under the VHIS are also offered under the VMIS. We would consider that the options provided by the VMIS are quite attractive. I do have follow-up, but I'll be brief because there are members waiting to speak. I would say that the new arrangements, that is, the arrangements for officers appointed on the new terms, are simply not equivalent to existing arrangements. And for the early withdrawal of the accrued benefits for taking out medical insurance would cause an increase in the administrative fees of MPF products. As the Secretary said, I do not agree, because the government would make variable contributions based on the use of service of government employees. So the funds or the fund companies may not be able to say for sure anyway how much would be invested in the funds. Well, that's it for me from now because I can see that other members have expressed their wish to speak. Mr. Kingsley Wong. Thank you, Chair. I agree with what was said by the chairman. I hope that the government will not close the doors on the discussion so soon. Because I did hear the staff side say that they do want better protection, even though I must admit that the government has been making quite significant voluntary contributions, and indeed that would be quite attractive compared to the private sector. I think we should allow more flexibility for civil servants to apportion the contributions. So people may have different needs. Some may have needs for housing, as the secretary said, but others may have different needs. Housing is an investment for most people. For those receiving pension, they will still have a fixed income after retirement that could meet their consumption needs. But for those appointed on the new terms, they won't. For most civil servants, they would get a 10% additional contribution. But if you consider that in a long-term perspective, that will not be adequate post-retirement protection for colleagues. So I think the fundamental concern is that we should resolve the root cause of the issue. And it is said that when compared to the benefits provided by the private sector, the benefits provided to officers appointed on the new terms are getting benefits on par with them, with those on the private sector, but those for those appointed on the new terms, they wouldn't think that way. They would most likely compare themselves to officers appointed on pensionable terms. I think that since the government has in their plans to provide Ruth's retirement protection for officers appointed on pensionable terms anyway, why not provide more for those appointed on the new terms? In fact, for officers appointed, they may withdraw the accrued benefits when they have a critical illness, and that essentially demonstrates that when it is a medical consideration, early withdrawal is allowed. It is said that for the age group of 50 to 65, the premiums would cost approximately $4,000 to $8,000 per annum. It is because most likely I would think that most of these people have purchased medical insurance early on, and even if they have made claims in between, they would still have relatively low premiums when they reach that age. So I do understand the Secretary's stance, but I suppose members are just trying to raise these points because the staff side thinks this way. And if the government does not close its doors this early on, this would facilitate discussions with the staff side. And the staff side does not wish to increase costs borne by the government either. Because if the government is faced with higher costs, they may not be able to provide services as much as they want to, because we only have that much of a budget that we can allocate. So I really hope that the government does not close its doors so as to achieve a win-win situation for everyone. Thank you, Secretary. Mr. Kingsley Wong said that officers appointed on new terms would often compare themselves to officers appointed on pensionable terms. I suppose that is unavoidable, but I wouldn't consider that to be a reason why we should not make changes. In the 1999 civil service reform, it is not only in this aspect. The reform is in multiple aspects. The reform was made upon careful consideration and extensive consultation and discussions. So the policy direction was set upon careful consideration. And as I said, the private sector would not provide such benefits either. So our benefits are on par with those provided in the private sector. So people working in the government will not be worse off. As for whether our benefits will be more attractive than those provided in private sector, I would point to the higher voluntary contributions made by the government, and that is quite attractive, I would say. I cannot prevent officers appointed on the new terms from comparing themselves to those appointed on pensionable terms. But I would say that we would always have to make changes and we have to keep pace with the times. Mr. Kingsley Wong also said that post-retirement medical protection can be achieved without incurring additional costs for the government. But seeing that the employee is making such low contributions to the MPF at the moment, voluntary contributions, we do think that government employees can afford private health care, and if they purchase medical insurance early, their premiums should be still quite affordable when they are older, and they should be able to get more protection in future instead of them taking it out later and then making a lot of claims, thus having their premiums raised a lot. As I said, in Singapore, they have made very high contributions, high voluntary contributions to the retirement fund in Singapore. So in Hong Kong, it is very much different because we have a very low voluntary contribution rate in Hong Kong. So I would suggest civil servants make reference to their priorities and make good use of their disposable income deducting mandatory contributions.
So, if Chairman permits, I'd also like to provide an opinion on the last point. If we allow civil servants to have an early withdrawal from the accrued benefits of voluntary contribution, the administrative fees will go up. Well, you mentioned that there is a tiered system, but that is a predictable system. We have the years of service to the service provider, so they can charge the fees accordingly. They can predict. Of course, some people will quit and so on, but the departure rate is also predictable. But if we allow them to withdraw money for medical benefits, how many people will do that? That is a very unpredictable scenario. So that will have an impact on the administrative fees. So they can also contribute more. Will that also increase administrative fees? Well, I have to admit that scenario is very minimal. So on this point, we feel that there is such a impact. So I'll stop here and take other questions. Well, I have some feedback regarding your comments. You mentioned administrative fees going up. Well, I don't think that is a big issue. Everything is done by computer these days. It can be handled very easily. But if you have a new policy and the fund manager, the funds they manage is unpredictable, well, I don't think that's a big problem. We have actuaries, people that engage in this kind of business. They have actuaries on their employment, in their employment. I also want to point out that not providing medical benefits for retired staff, so it's the same as a person who has left after 10 years on the job. From a private sector point of view, that is very normal, but that the government is different, because even when the civil servant leaves the civil servant, they are still a member of the Hong Kong public. The government has to provide suitable medical service to a member of public. So whether that person is a civil servant, is a retiree, the government does have responsibility. The government is very different from a private company. So when you compare the two, we have different factors that need to be considered. Next, Mr. Lam Jansing. Thank you, Chairman. I'm not a member of the subcommittee, but I'm aware that a lot of members are concerned about the civil servants can use MPF money to purchase medical insurance, or The government will the government undertake these services? The government seems to have reservations. So my view is the same as other members. I'd like the government to consider their position. So I will not repeat all the reasons that have been given so far. But in the paper, the paper says that since '96, there has been a voluntary medical insurance scheme. I've asked civil servants; they were not aware of the scheme. So maybe, Chairman, you're aware. I'm not. I'm not aware of the scheme. I'm only aware now. So they have some 38,000 subscriptions. So if you include currently serving civil servants and even retired civil servants, so the people who have subscribed to the voluntary scheme, they are a minority. So have you looked at the reason for this low subscription rate? Were there any questionnaires and surveys? What did the users feel about this scheme? Or is it not attractive? So civil servants might also subscribe to outside services. So some civil servants might feel that it's not attractive and just rely on the civil service benefits. So now our subcommittee members are asking for better medical benefits for civil servants. And at this point, you mentioned the scheme as an option. So how effective is this scheme? How popular is this scheme? Because some civil servants have not subscribed to it. So I'd like to ask, I would like more details about this scheme. Second, I have asked in other meetings whether the government could procure medical services in the Greater Bay Area for civil servants. Well, it seems that the government was open to this line of was open to this proposal. I'm not asking for an immediate promise or action or which Greater Bay Area cities could be included, but could you provide us with a timetable for study and review? You need to come up with a study before you can determine how much can be done. So we had medical vouchers that had been expanded to include dental hospitals for local seniors. So that is the overall trend. Now, if civil servants could also use Greater Bay Area services, that should be part of the policy. So could Civil Service Bureau undertake a 1-year study to look at the Greater Bay Area service providers that are suitable? We understand that the budget is limited, but could you do a study and tell us what items are appropriate or not appropriate? I think all these studies should be presented for discussion or for civil service groups to look into. So 2 questions, Chairman. Thank you, Chairman. In 1996, the government provided a voluntary contribution scheme, and there are 55,000 subscriptions. So whether colleagues subscribe, it's a voluntary decision. as I said just now, some people might have higher priority for housing or medical expenditure. Some people might want a larger coverage, or whether it is equipment needs, pharmaceutical needs, or they might seek more coverage, or they might want private sector healthcare. They might want a single person a room in the private sector. So if you look at the scheme, it is quite popular. I had described this just now. So what kind of insurance products could be included? In fact, our staff side colleagues have participated in these investigations and look at the coverage. We have, if we come across good schemes that have good coverage, and if the premiums are not excessive, are reasonable, those would be included in our scheme. There is full staff side participation. I feel this is a good scheme. But no matter how good it is, it also depends on an individual choice. You cannot force people to participate. So in this respect, the subscription rate is not low, and we have done publicity work. For example, in government buildings, we have exhibitions, and in the future we will step up promotion so that they can be aware of these products. And I will not say that they lack attraction. It's just that different individuals have different needs. Your second question on whether we will procure Greater Bay Area medical services for civil servants. First of all, according to civil service guidelines, regulations, services have to be provided by the health department. So even for outsourced services, such as dental services, these are still regulated by the health department. So they stand by the quality of these service providers. So if you look at medical services outside of Hong Kong, if there is an environment to conduct that, we still need the participation of the health department or the hospital authority. They have to be able to monitor the quality. So I will not rule it out, but we have to be careful. So aside from hospital authority and health department being able to uphold the quality, we currently cannot increase the expenditure. We have to, if we have schemes more than the dental schemes that we currently have, it needs to be effective. We also need to ensure that the expenditure is well spent. We also want more civil servants to benefit, and rather than just a small group. So if it can meet all these requirements, I won't rule it out, but we have to be very careful. Any follow-up? The GBA situation, I'm very happy that the Secretary has not shut it down. The Secretary is open to this idea. My concern is that you can outsource services for civil servants. It's not provided directly by HA or health department. The Hong Kong government, the health department, need to monitor the quality. So, health department is aware that the quality or the services provided meet our expectations. So, in the GBA, the different cities, there are these medical service providers, and they already accept Hong Kong elderly medical vouchers because the health department has looked into it, and these institutions have been vetted, and there has been communication with them, and they can ensure that the quality and standards are similar to that of Hong Kong.
後咧，即係我
I would say that in future, if these institutions can provide services to civil servants, the administration can prioritize implementing such arrangements. I do understand that the administration said the VMIS has been working smoothly. I would suggest the administration to review the scheme to see if there is any room for improvement. I do understand that it is working well at the moment, but I guess we can adopt a combination punches approach. While you can see if you need to enhance the VMIS, you should also consider other aspects such as increasing the number of civil servant clinics. But all I was saying was the VMIS was launched in 1996. Since it has been quite a while, I believe the administration can review the scheme. Thank you. Secretary, let me clarify something. It's not the case that we did not make any changes to the VMIS. Every year we would review the products offered and make changes if necessary. But I do think the members' suggestion, we will definitely do more in terms of promotion so as to facilitate colleagues making the right choices for themselves. Thank you, Mr. Dennis Leung, speaking for the second round. Thank you. I would like to follow up on the issue I mentioned earlier. Officers appointed on the new terms do not have post-retirement medical protection. So on post-retirement medical protection, I would say it is important to ensure that post-retirement medical needs of officers appointed on new terms are covered. You have provided VMIS, but then after all, it is voluntary. How can we ensure there is indeed adequate post-retirement medical protection for officers appointed on new terms? Regarding provident funds, for the subsidized school provident fund, there is a formula for the calculation of dividends. One is that the reserves would have to be above 40%, and then additional dividends will be distributed on top of the 5% mandatory dividends. Otherwise, people would still get the 5% guaranteed dividends. If returns are high, it can get as high as 15%. So it protects the fund in this regard that if they do not have enough in reserves, they will not have to hand out additional dividends. So I think in the past 10 years, only 2 years would have them pay out additional dividends. So I think with the adoption of the formula, it ensures the sustainability of the school's provident fund while providing guaranteed returns to beneficiaries. It also allows for funds to be retained in the provident fund so as to make sure there is development of the fund. In fact, I myself have worked in the teaching sector for 23 years, and I have $3 million in my Provident Fund account, the subsidized school's Provident Fund account. So I think what is important is that people are concerned about not just the fees of the products offered under the CSPF scheme. They are also concerned about the lack of options, lack of high return options. For funds, the subsidized schools provident fund, they would invest in different products, local stocks, overseas stocks, bonds, and others. The fund managers hired, some would manage index funds and some would practice active fund management. So they have multiple fund managers for different funds. They would, for example, for a single fund, they would have 3 fund managers practicing different styles of investment. So altogether, there would be over 20 fund managers. And they have quite an established mechanism. If the returns isn't high on a particular day, the verbal warning will be issued. If there are continuously low returns, a written warning may be issued. After that, it may also be the fact that the managers will be stripped of his duties or his or her duties, and the funds will be managed by someone else. So I believe the administration should provide more options with more attractive returns, and that will definitely help retain talents in the civil service. As said by other members, right now, the costs are very low for people leaving the civil service. While I do understand the government is making relatively high voluntary contributions, but the highest voluntary contribution, 25%, would only start when people have worked in the civil service for over 30 years. So basically, that would mean most civil servants would be in their 50s when they get 25% in MPF contribution or CSPF contribution. So you may be able to provide training or other forms of fringe benefits, but this really matters. And you should know that civil servants with quite a number of years of experience are very attractive to the private sector. So if they leave, it will definitely be a loss to civil service. So will the administration reconsider its position? Thank you, Secretary. Thank you, Chair. In fact, some members have raised the issue that civil servants may want to leave civil service after 10 years, but I would like to remind members that the civil servant concerned or the individual concerned will not be able to withdraw the benefits. And in fact, for civil servants who have worked in civil service for 3 years, they would already get 15% contribution into the CSPF scheme. I would consider that quite attractive. While the government should always review measures to retain talents in the civil service, but I would say that the package that we are offering right now is quite attractive, even when compared to those provided by the private sector. I do thank Mr. Dennis Leung for explaining in detail how the grant or subsidized schools provident fund works. But I would like to emphasize again that subsidized school teachers amount only to tens of thousands, but we have over 180,000 civil servants. So it is really important to consider the costs of the running the funds as well as the sustainability of the funds. And I think that what we should do right now is review the CSPF scheme and make improvements as necessary to benefit the civil service. And I think the MPF authority, if they consider that there is room for overall enhancement of the MPF scheme, they will do so. I do thank Mr. Dennis Leung for raising his points. However, I will pass on such views to the MPF authority. Thank you. Chair, I do have a follow-up. I just want to say that we need to review the CSPF scheme. It is very much necessary because if right now we have funds that are not very competitive because it would rely on the civil servants paying for the funds while they also have to make many selections on the funds, and that is not desirable. Thank you. Well, I would say that the administration should consider enhancing its role in the CSPF scheme. When selecting the products to be offered, can you do more? Well, Chair, employers would select the trustees of the MPF scheme, and when we select the trustees, we would look at the different options they offer, whether it provides the right choices for civil servants, their service quality, as well as their fees. But having made that choice, after making that choice, it would rely on the civil servants to select the right options for them. All right, I believe this is the end of the discussion of this item. Let me give a summary of the points raised by members. Many members have expressed views relating to areas where the administration can improve on regarding the CSPF scheme. I hope the administration can follow up on the concerns raised by members and report to members when there are any updates. This is the end of the meeting. We have no other business today. Meeting adjourned. Thank you.